Hi, I'm Dan Leonard in the East.
And I'm George Whittam in the West.
And together we are East-West Audio Body Shop. Well, we've been patient, we've been good, and he'll be our guest this week. Yes, it's my otolaryngologist, Dr. Joel Bernstein. You don't want to miss him because we'll talk about vocal production and taking care of our voices.
Very, very important. You do not want to miss this. I'm going to talk about setting up a mic preamp. If you've got a mic preamp, a channel strip or something, and you're just dying to get the most out of it, I'll tell you how to set it up correctly so it works well with your mixer or your audio interface. It's not quite as simple as it might seem.
And on my tip of the week, we'll continue my series on how I built my new home studio and dealt with some of the acoustical challenges that we had in here.
And I'm going to show you my pick and clip of the week. We've got something that I captured on Wednesday night at the Don LaFontaine Voiceover Lab. I think you guys might get a kick out of it.
All right, and join us in the chat room too. EWABS, Sunday night at 9 in the East.
And 6 o'clock in the West.
We'll see you then.
He's the voiceover studio engineer of the Stars in Los Angeles, California, a Virginia Tech grad with a knowledge of recording studios unmatched in his field. He's a voice actor from Buffalo, New York, with 30 years experience in recording studios and behind the mic. He solves people's home voiceover studio problems in the blink of an eye. Together, there's no studio problem they can't solve, and they'll do it for you tonight. Welcome to East-West Audio Body Shop. Now, live from a basement in Buffalo and an office in LA, here are Dan Leonard and George Whittam.
Hi, I'm actually Dan Leonard in the East.
And I'm actually George Whittam in the West.
And together we are
East-West Audio Body Shop. What the heck?
Wait, there's more there. There's more going on.
What the? Well, who was that?
Usual.
All right, I better.
It's
maybe
me.
Oh, there. I
John Taylor, America's voiceover sweetheart. And I'm here to answer any questions you may have about life, about love, about portable voiceover equipment.
Well, you've come to the right place. Well, good evening, everybody. Another spectacular Sunday night with another fantastic start off to our show, as usual. Some nights Skype is there, and then some nights it's which might explain why I'm so choppy and so far behind the
right
times
now,
here.
It's looking good, Dan. Right now, it's looking good.
It's catching up to it.
Don't jinx
Maybe
it.
if I talk a little slower, maybe it'll work a little bit better.
Yeah, it's working good now.
Anyway. Well, I'm no longer in a basement in Buffalo. I'm now on the second floor, as many people are aware, and we'll talk about that a little bit later tonight. But our special guest tonight, aside from our super special guest, John Taylor, who's actually joining us over there in Santa Monica, California, our guest is Dr. Joel Bernstein, who we've been waiting patiently for all these months to talk about vocal health and how our larynx and our vocal folds actually work. Did I pronounce that right?
Absolutely.
Okay, good. And it should be fascinating. And you're absolutely brilliant for being with us tonight. And there's a lot of you there tonight. God, you guys will put up with anything. You don't even want to watch the closing ceremonies to the Olympics. You've had enough, haven't you?
We're ready for Shark Week.
Probably the Shark Week. Shark Week. That'll be the fun part. Okay. So we've got a lot of stuff coming up. I think it's time we go to, let's see, you're going to talk about gain staging, and I have my thing about the new studio. We've got Dr. Bernstein, and John's going to be there just, interjecting anything he wants to at any particular time, whether it makes sense or not.
Mm-hmm.
Sort of like what goes on in my house all the time. And we have a new feature tonight, announcements. Don't all applaud at once.
Oh.
Announcements.
Cute.
Announcements. A horrible way to die, a horrible way to die, a horrible way to die to death. Announcement. Okay. Anyway, we got a bunch of stuff going on. I know that Cliff Zellman told me we had to mention this down in Dallas. Let me see if I can get that note. Something about Amy Snively is going to be down there. Let's see, where is that? I know I have it. This is called Total Preparation.
Is there going to be an inflatable blue dolphin?
I'll bet you she brings one with her.
Probably so.
Let's see here. Where is Zellman? Come on, where are you, Zell?
That was a nasty joke for a minute. The way
inflatable blue dolphins. Don't leave home without them.
Anyway, the Dallas voiceover meetup group Amy's going to be there, and that apparently sold out very fast.
Nice.
Yeah, so all you guys down in Dallas who are listening right now or watching right now or listening because you can't see me because I'm 6 seconds behind, Amy's going to be down there. Also, what were some of the other things that we had on that list?
I have a list while you find your list.
Did I have a list, Dan?
Yes.
It was right in there. It was in the show clock.
On the show club.
We have to send out our huge group hug to DB Cooper, who we love very much. And
who lost her dear friend.
Yeah, Fritz, who was awesome and an awesome human being and just a wonderful partner to DB and a tragic loss. And she's been there for so many people in the voiceover community. Yeah. Just send out the hugs to DB. She's in
Absolutely.
Hawaii right now dealing with that.
Indeed.
And recently we had our friend Jay DeLay have everything stolen from his house in Atlanta while he was with his family at the Little League World Series. And DB did this big, basically a telethon.
Yeah.
And really helped him out. And she's always there when there's a shit storm in life and the shit clears. DB Cooper's there to help.
She's a fantastic woman.
And we got to be there for her, at least in spirit, in any way we can.
Absolutely.
So we love you, Deebs.
Yeah, and that's one thing about the voiceover community. We do take care of our own. This is a great community.
In other announcements, we had that poker night last night to raise money for the Don LaFontaine Lab.
And how did that go?
It was a lot of fun. That's why John's here. He didn't fly in just for our show. I could have lied and said that he did, but he flew in for that, and he was hosting us throughout the evening on camera. And,
Guests of EWABS fly on JetBlue.
And we had a blast together.
It was a lot of fun. Everybody had a great time, and there were a lot of people that flew in for that too. Bob Hurley flew in from the East Coast. We had some other folks from Atlanta. Jay DeLay flew in, and we saw a lot of people come together. And it's, as Bob Hurley put it today, it's that event you got to do at least once. And,
right.
It's going to happen every year at this same secret venue in Hollywood. A very secret. It's actually stately Wayne Manor. Is where it's held, and it's going to be there according to Joseph every year. It's all signed.
If they want us back, we'll be back.
Yeah.
If we didn't leave cigar butts all over the place.
Everybody had a blast, and
Did
Randy Thomas.
Did anybody out there watch?
We had a peak of about 13 or 14 viewers at one point.
Really?
Wow. Well, you're going to get an Emmy for that.
That's more than Piers Morgan.
It's true. It's more true than all of CNN.
The best thing was how I managed to pull off the stream.
Oh, you are MacGyver.
We started with we went through all these different iterations, and by the time the last, the majority of the stuff you actually saw was literally shot with two main pieces: an iPod Touch and a Verizon MiFi, which is the new LTE version of the MiFi. It's the very fast 4G thing.
But it is not unlimited data like the old Verizon plans. You pay for the data, or Joseph pays for the data. When the bill comes in, he's going to love that.
That's what I told Joe. I was like, you're going to love this bill, Joe.
Nice.
But he brought it as a backup because my phone would not connect to the gadgets we were using. So anyway, thanks. Shout out to Joe Sip for providing the bandwidth.
Absolutely.
But it worked pretty much flawlessly. So that was a great time.
And thanks for tech support back at home from Amy Whittam.
Yeah, I called her 2 times to fix something in our feed, So she's awesome.
Yes. Also, what else in announcements? Oh, we have our new producer Kathy Kerndon she makes sure that we talk about the East West Audio Body Shop.
You mean is that to say that someday she'd like to actually receive a paycheck?
Well, she gets swag. I mean, come on.
Can I make a swag endorsement? I got a mug, and I am a.
If you got a mug,
I have I bought one of the coffee mugs, and I, as you know, am a coffee achiever. What is this stuff in this here? What do you call this?
Water. It's water.
Throw that out.
That's what we drink around here.
Well, the coffee mug is the ceramic coffee mug is an excellent coffee mug.
Oh, good.
It's better than any of the other coffee mugs I have. So it is now my coffee mug of choice. So it's a little bigger than a normal coffee mug.
Is that what it is? It's the size?
It's the size, the heft, the grade of ceramics, the graphics. The only thing that I hate about it is your faces.
You might have to stick a logo from your station.
I
on
put a
there.
sticker over your faces. No, it's an excellent coffee mug. So as swag goes, it makes a wonderful gift, and you know the holidays are right around the corner.
That's right.
Yes.
Got to prepare now.
Well, they're a little farther down the street than that, but anyway.
I didn't say
But we
which
got a lot of things
holidays.
to cover. What's that?
I didn't say which holidays.
Right.
Oh, okay. Well, the high holidays are coming up, so
That's true.
Right.
not necessarily a gift-giving time. All right, so we've got lots to talk about tonight. Dr. Bernstein will be with you. You want to stick around for Joel Bernstein. This
Yeah.
guy is amazing.
Yeah.
He'll absolutely blow you away with what he knows about your larynx. So,
Excuse me.
absolutely. But you wanted to talk about gain staging tonight.
Yeah, let's
Or
do
as we
that.
like to call it setting proper levels.
Setting levels. Yes, setting levels. I'll keep this short because we've got a lot to talk about, and I don't want to drag it out now that we've had such an exhilarating opening to the show. Basically, when it comes to gain, you know what? I still don't have a oneer of me. There we go. This is the closest thing I got. I got Dan the floating head. That'll work. So gain staging, a common thing that I would hear a lot of, especially when I was still doing audio evaluations for that other accreditation society that we shall rename nameless.
Former accreditation.
Yes, what we heard a lot was former was noise floor issues, and Dan talked about white noise, and we've covered it quite a bit. But I just wanted to summarize really quickly what is the solution to many of these problems when there's too much white noise happening. And basically what it is, it's a matter of the gain being increased at the wrong stage of the sequence of the signal, right? So it comes in through the mic, then it goes into the preamp, then it goes into the computer. Now, if you have a nice, simple, clean system, that's the way most of you are going to be working. You're going to be using a Harlan VO1A or an AT2020 or even a Neumann TLM103. Plug it right into your Apogee 1, your MicBoard Pro, your M-Box, whatever, and straight into the computer. And for the vast majority of you, that is what you should be doing because it works, it's simple, and generally you get a really good clean signal, especially if you're using a condenser mic. But some of you are doing a little bit more complex setups. Maybe you felt like there's something you want to get out of that preamp that you can't get out of a more direct signal chain, and or it's just sitting on the shelf and you can't stand having it there and you just gotta use it. This is the way to get the most out of it. So the key is, and I'm not going to use scientific term because I don't know what it is, but basically you want to push the signal through, not pull it through, right? So you want the most gain to happen at the front of the signal. So if you've got a mic preamp, you should be hitting it with as much gain as you can. Get the levels nice and hot. If that thing has level meters, make sure it's getting close to zero, as much gain as you can. Then at the output side of that, you can run it pretty hot as long as the next thing it's plugged into can handle it. So let's say, for example, it's going into a little Mackie mixer, which a lot of us use. The input gain on the Mackie mixer should be pretty low, so it can accept the very high output of a preamp. Okay. Then, if it's going out of a mixer into an M-Box, same deal. The output of the mixer should be nice and hot, and the input to the M-Box should be relatively low. If it has a pad on the input or whatever the interface is, usually you'll have the pad turned on so it can accept a much hotter signal from the mixer. And generally, that seems to work. If you're giving, pushing the signal through the signal chain instead of pulling it from the interface, you tend to get a lot lower noise floor. Oftentimes, literally, it's a matter of, oh, you're using an M-Box and you're using a Eureka preamp or whatever, or a 528. Well, turn this knob this way and turn that knob that way. And all of a sudden, you'd be amazed. Sometimes you get 5, even 10 dB of loss of noise floor. Increased noise floor, or a drop of background noise. Is that the way to say it? Something like that. Yep. So that's my little short crash course on gain staging. Basically, it doesn't matter how many pieces of gear, it all pretty much works the same way. And if in doubt, remove stuff from the signal chain. Start simple. You can always add more stuff in later if you find out that there's something you're missing for some reason from your signal. And if you don't know why you're doing it, ask one of us. Send us a sample and we'll take a listen.
But here's the most important thing, guys. You got to learn how to use one of these.
The VU meter.
The VU meter.
Tell us more about this new VU meter thing.
Yeah, it's real new. It's only been around since, what, about the 20s?
Probably.
Just talking about basic modulation. If you can learn how to use the digital meter in your software, that really solves a lot of problems. You've got to get your gain upwards of at least -6. Yeah. And if you don't know what I mean, we need to talk. Anyway, we've got a lot more going on tonight, but that was an excellent explanation, George.
Thank you.
All right. Well, we're going to talk a little bit more about my new studio that we're now. This is so much more comfortable in here. I mean, I've got room. I've got room for guests. I've got room for books. Not that I read any of them, but but we'll talk a little bit more about that in just a couple of minutes. Dr. Bernstein will be with us. John will be here annoying us for the next 45 minutes probably too. No, you're doing great, John.
Thanks.
You're welcome.
I need your approval. I'm very needy. I'm a voiceover.
You haven't been on. It's been way too long since we've had you on.
6
We're
months.
glad to have you back.
Since I was in prison.
That's way too long. Ooh. Anyway, but we'll be right back here in East West Audio Body Shop, so you stay right where you are.
El Dorado Recording Services.
Randy Thomas chiming in.
This is Alex Verdi.
Hi, this is Bill Ratner in Los Angeles.
Hi, this is Scott Rummel here in Yorba Linda, California.
Hi, my name is Rick Wasserman.
Hi, this is Tom Kane.
Hi, my name is Vanessa Marshall.
Hi, my name is Zurich.
Hi, I'm Mary McKittrick.
Hi, I'm Peter McHugh.
I was turned on to George by none other than Don LaFontaine, who always swore by his health.
George is absolutely awesome.
ISDN, Source Connect, Phone Patch, FTP, you name it, George has set it up.
It's really the best thing I've ever done for myself. I feel free, safe, fearless, like anything is possible in here.
Unless you like to look for opportunities to waste time, call George.
And he did all of that, long distance over the phone and the internet.
I'm very happy with George, and I cherish
I've got my travel kit, I got my Source Connect, I've got it all going on, thanks to you.
Thanks, George. You make it easy.
This is East West Audio Body Shop with Dan Leonard in the East and George Whittam in the West. Now, back to Dan and George.
All right, I guess we're back.
We are indeed.
That sounded an awful lot like Morgan Freeman.
It did sound, but it wasn't Morgan Freeman. Well, maybe it was.
No, he wants Larry Davis and Elizabeth, his fiance. They want to do some new fresh ones for us, so we're going to have that from them soon.
Saw them last night at the Don LaFontaine Poker Classic at a secret location high above Stately Wayne Manor in Hollywood. Yeah, I get out to Hollywood. And Elizabeth is now the voice of Maybelline.
That's right.
That's easy breezy. Something Maybelline. Oh no,
maybe
that's
it's
CoverGirl.
something. Maybe it's Maybelline.
Yeah, maybe it's Maybelline.
Maybe it's genetics.
She is.
Maybe it's Maybelline.
She's the voice of Maybelline for sure, for real.
They are becoming Hollywood's power of voice couple.
Yes, and they must be stopped.
When are they getting married? It's like sometime next year or something like that.
Something like that.
I think.
Could you imagine the children?
Oh
and their little voices. It's like like a 4-year-old little Larry.
Hello, Daddy.
Hello, Daddy. It's I, your son Morgan.
They'll all talk with Texas accent.
And we want to say hi to Doug Tickell. Hi.
Hey, Doug.
Miami.
The announcer.
The announcer. How are you, Doug?
Yes, sir.
All right. Yeah, and Doug and Cliff is there.
Bob Hurley.
Hey, Bob Hurley's with us tonight too.
He was at the Poker Classic last night,
and he's with us here too.
Evidently, the ankle bracelet isn't required as a condition of his probation anymore. They let him out.
Dan, should we go to your package?
Let's get on here with a few other more interesting things, because most of you don't live in Hollywood. So what do you care?
I don't.
Like me, I'm here. I'm not in my basement in Buffalo. I'm up on the second floor now, but it is the hinterlands when it comes to a lot of voice work. But that's where most of us are, and that's why we're here for you. So to explain a little bit more about how it is that I built this new marvelous facility, here's part 3 of my tip of the week. Well, I'm having a great time here in my new studio, but a lot of decisions really went into making this. The original planning, and then, of course, like most warfare, all plans go out the window when certain things aren't exactly the way you hoped. But most of it went very smoothly. But one of the things we had to deal with was acoustics, and that's our tip of the week this week. So as it turns out, I wasn't totally thrilled with what went on up here. You know, the sound in here was still kind of boomy, and it didn't work with just the tiles that were up there, if you remember us putting them up. So I came up with another solution. Remember all those silly science projects your kids had to do? And remember all these great boards? This is the answer. They're the perfect size for a piece of Orlex. They're 4 feet wide. So we can, like, use the spray tack on here and neatly fit a piece of Orlex on the cardboard. And then do the same, cutting some pieces here to create the opposite pattern. That's the way to do it. And I'll show you what happens when we do this all together. So to get this thing in here, it's real easy. It's the same ceiling size as the booth. And I've got all this stuff on the side. I just slide it into place. And it holds itself into place. And it sounds a lot better in here now. So the next thing I had to do was consider my main studio control room here. Because a lot of times maybe you want to record in here. And this is actually a pretty good space because you're working here, you're right in front of your computer and stuff. And you want perhaps a slightly livelier space for certain things. So what about in here? So the same idea with the Orlex and the panels, only take it a step further to make it a little bit more aesthetically pleasing. Now to make this really neat, here's what we can do. Cover it with a fabric that's a good fabric that's going to match the room, and it's going to make it look a lot nicer. And then just staple it in. It's like upholstery, essentially. And voila, a very nice panel to hang on the wall. So now, as you can hear, I've created a totally different space to record in that's also not too lively, certainly no room reflection to it, and will work for certain types of reads. So as you plan a new studio, realize that it's not going to go exactly the way you planned, and that you're going to have to make adjustments. But be innovative, be creative, and use the materials you have, and that will certainly save you time and money. And that's my tip of the week. All right, and here we are, live. Now we have to come up with a name with this place, because you know the other one was the Black Hole of Calcutta, because it really was.
Why Calcutta? I've always wondered that.
Well, no, it was a poem.
Oh,
I think it was a Rudyard Kipling poem about the Black Hole of Calcutta or something along those lines.
Well, there you go. That just
Is that right, Joel? Right. Okay, I was
Absolutely
right. All right.
right.
Yes. 2 questions right today. Anyway, no, but yeah, I just don't tell my Indian clients that's what it was called. But we've got to come up with a new name, because this one is like, well, this used to be Marcy's office, so it's a bright yellow.
Right.
But it's more bright, and I actually have sunlight in here now, and it's actually good. It's also, as we're noticing, very warm in here. But then the light, we've got all the lights and stuff. But it's working very well. I think we'll have one more on the series of what I did in here. We talked a little bit about monitors a couple months ago, but I had to go through quite a rigmarole to get the monitors working in here right.
Yeah.
That is, the visual monitors. The studio monitors, they work great. They're KRKs. They always work. But getting a monitor into the booth itself, and I'll give you a little tour how well that works. We'll do that next week.
I would say that's
It'll
worth
save
a
me some
show in
time.
itself, yes.
Yes. But speaking of studios, I know for a fact that Mr. Taylor brought his road rig with.
Oh, yes, I did. Here, would you like to see it?
We certainly would, my friend.
No, wait, I don't want to see it. I just wanted to, you can just talk about it.
Would you like me to unzipper it?
Oh, unzip that studio.
All right. I've now gotten the road kit down to these. Hey, we're doing some TV over here. Keep that yappy dog quieted down. Your neighbors are going to be shooting at you, aren't they?
Boy, that cat really has developed a bit of a growl.
Oh, David's going to love that. Can't wait to talk to him later.
Keep that damn dog down. All right. This is the road kit down to its purest and smallest and most diabolical form. All right. All right, so on the sides, we have, I will unzip these various compartments. Oops, that's not the right thing. All right. This is, on this side, we have, what do we, hold this. Help me out here.
Okay, it's a little shock mount.
And what do we have here? The
We have a MicPort Pro with a headphone Y adapter on the back, which we're about to find out why. And
why?
Because we like you.
Yes. And what do we have here?
Oh, that's the Rode NTG3, and it's amazingly combative tube.
It looks like a pipe bomb.
But you actually have to carry a license to put that in your car.
There you go. Connect it to our MicPort Pro, please.
Yes, sir, doctor, sir.
What do you think of that?
All right, so that goes down the side. Now, inside the little compartment here, we have the... I bring a trackball mouse because I actually do edit things. So trackball mouse makes your editing go by 33 1/3% faster. So that goes into
less repetitive motion.
The
injuries.
netbook. The netbook, as you can see, so.
That other computer you had was a different. You don't use the other one?
No, that's not a PC.
That's actually a tablet.
That's a tablet, so that doesn't have recording stuff. All right. And what do we have here, buddy?
Oh yeah, you got some duct tape on it.
Yep, it's been around a while.
We won't ask what that is, but man,
it does look like something that one might find at the pleasure chest, but it isn't.
I shall assist.
And that is something that you would use to clamp to the headrest of a rental car, the steering wheel, the visor, whatever interior parts of the car one might want to clamp some sort of a microphone to. I bring this thing with me every day. And you see some of these people who are the cream de la cream of the voiceover firmament, like Bo Weaver, always walking around with a backpack.
Yeah, that's true. He does.
Zurich, he's doing all sorts of stuff. So, and there you go. I mean, we just put it up. That's ready to go. No, it isn't.
Sort of.
You think you could tighten that up a little bit better?
It's limp.
Okay. All right, there. Look at that, ready to go. And you've got it plugged in. We've got our netbook here, and that goes into this one.
So again, what's the head? Why do you use the headphone Y adapter?
Why the Y?
Why the Y adapter? Because at the radio station, I plug this netbook in, and the earphone, the 1/8 inch jack has a very fat adapter.
Oh, it doesn't quite fit next to the...
It doesn't fit next to the USB in, and I didn't want to break it.
That's the only design flaw, I think, of that device.
It's
is
a little
the way,
tight. Yeah,
they'd really clustered all of the connectors into the back.
And that's about it. So I put a Y thing on there.
Good
but
idea.
Anyway,
cool.
So this is the smallest bag possible for this thing. It's a shaving kit from Walmart at $10. Yeah, it's a man's shaving kit, and there you go.
Sennheiser could learn a thing or two about the tube that mic comes in.
That tube is awesome.
That is phenomenal.
Yeah, it's a great mic too. The NTG3. It's $6.99 is the retail price. Where's my tube?
Your tube? I don't know actually what you do with it.
Oh, okay. I may still have it
somewhere.
Anyway,
and then your software of choice?
Software of choice, because I'm PC, is Adobe Audition. 3.0.
Oh, 3.0. Okay, so you're hanging tough with 3.
I got the Creative Suites 5 and 6. And because they wanted it to be compatible with Macs, they compromised some of the best functions of the software. In order to work quickly, I need to stay with the 3.0. If you do upgrade to the next version, 6, it does not disable 3.0 on your system.
Well, that's good. You can run them both at the
You
same
do have them both.
Good.
Yeah, and so you can continue running it. So,
well, that's progress.
So yeah, and I think we need to move on because I'll just pack this up. But I just wanted to show everybody.
Thank you. Thanks for sharing it.
Yeah, that's really cool. Now, you usually record in a car, or do you try to find a good closet somewhere?
I don't. I usually try and find a car. I think the car interiors are awesome for acoustics. They've really designed these things using lots of acoustic modeling.
I see a tip of the week coming up, Dan.
You do?
Your in-car, studio.
The in-car studio. Oh, yes, I was talking to one of our...
As I'm driving over to Duff's, I'll record something.
Yeah, actually, John, would you mind doing that? Because I know you do that from time to time.
Sure, I'll do it.
Shoot a little bit of video?
Sure.
Yeah.
Awesome.
I was speaking to somebody last night. Oh, Bo Weaver.
Mm-hmm.
He just did a ton of stuff from
a reservation.
an Indian reservation in North Dakota.
He said he happened to be at an Indian reservation that had their own AT&T 4G tower on the reservation.
Yeah.
So he said, I had better internet upload on a reservation in North Dakota than I do in my home studio.
Yeah, but he was doing, national network promos from a car.
Exactly.
Yeah. And he's blazed a lot of trails.
Yes,
he was one of the first home studio people, and he's still innovating. And I think a lot of the perfection of this small kit comes from you too.
Bit of an influence from all of us. Yeah.
Yeah. Everybody's sharing. There's no secrets. We just share it all.
Yes, sir. Thank you, man.
Thanks. Let me zip her up.
All righty. Okay. All right. Well, you guys have been patient enough because we've got a really special guest on tonight, and you guys are going to want to listen in with your ears while they still work. Dr. Joel Bernstein will be with us in just a minute, and lots more to come up here on East West Audio Body Shop. So stay right where you are.
Does your audio make you sound like you're in a train tunnel? Or an art gallery? Or your bathroom? And you don't even realize it. Understanding small room acoustics is vital to your success in producing quality sound in your home studio. Acoustics is mostly about listening and knowing what to listen for. On Tuesday, August 21st, the Home Studio Master and VoiceOver Extra present a comprehensive webinar, Home Studio Acoustics, DIY Remedies, and Prefabs. If you've got a home studio or considering constructing one, this webinar is a must. Here's what you'll see and learn. How to select the right room and location for your home studio. Room reflection, what it is and what causes it. How room size and building materials affect acoustics. And how to identify where problems exist. Got some acoustic problems now? I'll show you some DIY remedies for that. How to eliminate or reduce common acoustic problems. How to use special acoustic dampening materials. Materials to avoid, and proper room setup. We'll also talk a little bit about those prefab booths that everybody talks about. That's Home Studio Acoustics, DIY Remedies, and Prefabs, Tuesday, August 21st at 9 p.m., 6 p.m. Pacific Time. Tuition is only $29.95 and includes a full audio-visual webinar recording. Register to learn now at voiceoverextra.com.
This is East West Audio Body Shop with Dan Leonard in the East and George Whittam in the West. Two guys I love spending Sunday nights with.
We are back.
Right. I'm going to assume that we're back.
We are indeed.
All righty. Well, we have been waiting for months, at least since May, to get this very special guest on. This is a guy who personally saved my life. You actually did. Well, I mean, you at least referred me to a doctor that did. But we'd like to introduce Dr. Joel Bernstein, who is an otorhinolaryngologist.
Excellent.
Thank you. All right. He's an ear, nose, and throat doctor. Can you hear us okay, George?
Yeah, we hear you great.
All right. Frank and Mike is working great tonight.
He's doing well.
All right. But we want to talk about the voice, because you are an expert on the physiology of our heads, our ears, our nose, our throats, all those sorts of things, right?
Yes, I am, Dan.
Okay, good. well, that's all for tonight. We'll see you all next week. There's a number of interesting things that a lot of people in voiceover want to know about, because we use our voices professionally. And but we don't know a whole lot about how it actually happens. We know how to control it, which sort of lends to one part of the discussion. But what goes on? I mean, let's really let's talk about. Gee, I just erased all my notes, but that's okay because I remember I had them memorized. When we talk, where does it all come from?
Well, Dan, first of all, let me say it's a pleasure to be with you.
It's great to have you with us.
And there have been many textbooks written on the voice, so there is an incredible amount of scientific technology. So I want to tell you that what I'm going to cover tonight with you, based on your questions, will be very superficial, but hopefully meaningful to your audience. You asked me a question, where does it start?
Where does it start?
Believe it or not, it starts in the brain. A human being, before he even says a word, first has to have a stimulus from an area which is located in the posterior inferior frontal lobe, which is called Broca's area. Now, it was named after an anatomist, Broca, who found that when lesions of this area occurred, people could not speak. They could understand, but they couldn't speak. So from Broca's area, which is the initial part of the brain where the thought of speaking occurs, it then an impulse, a neuritic impulse goes to the motor cortex of the brain. And then it goes down through the brainstem, through the vagus nerve, and I want to emphasize the vagus nerve is the 10th cranial nerve, and that is the nerve that innervates all of the muscles of the larynx, spelled L-A-R-Y-N-X.
Right.
It is a fact that most professional singers, most professional speakers have never seen their instrument. A violinist sees his violin. A trumpet player sees his trumpet. A human being, rarely, even a professional singer, unless he is in a good laryngologist's office who takes a photograph of his vocal folds, has never seen the organ with which he makes a living.
I have.
So, I know. So the point is that it is an incredibly delicate, fascinating, extremely complicated mechanism where the brain first reacts through the motor cortex, through the vagus nerve, through the muscles of the larynx, which then innervate the vocalis muscle of the vocal fold. But it's much more complicated than that, because if you stimulate the vocal fold with an electrode and stimulate the muscle, nothing happens.
So your voice doesn't actually come from your vocal cords then?
The voice does come from the vocal fold, but it's much more complicated. Let me divide it into three areas, Dan.
Okay.
The actuator. The actuator is the air from the lungs. The vibrator, which is the vocal fold vibrating.
Right.
And the resonator, which is the mouth, soft palate, hard palate, teeth, sinuses, frontal bone of the head, where you get the quality of sound. For example, if you took a trumpet and took out the mouthpiece and just blew through it, all you'd have is air.
Right.
But if you then put it into the instrument, you would have the quality of a trumpet sound. So the resonator is where the speakers are getting their quality of voice. So we have air that fills the lung, the diaphragm goes down, the muscles of the chest, the extracostal muscles and the external oblique muscles, you don't have to remember their names, but they're muscles of the chest, then allow the lungs to expire, and when the air goes through the vocal folds are vibrating 100 to 200 times per second, 100 for males, 200 for females, we're an octave apart, and then the air goes through that small glottal space between the vocal folds, and then the air goes into the mouth and out of the mouth, and that's when the sound appears to the listener. And that's it in a nutshell.
No, that's more like in a watermelon, Joel. But well, that's a mouthful. Pardon the pun. But it's interesting that it is a complex thing. I mean, it's if you look at a harmonica is actually kind of complex. You got to blow through it, and different vibrations and stuff like that. I mean, we talk about the frequency of somebody's voice, and that and everybody's voice is completely different. Like my voice is different from yours, but are there similarities? Or?
If I looked at your vocal folds and you looked at my vocal folds and you looked at the vocal folds of James Morris, who was one of the great bass baritones of the Metropolitan Opera, it is very likely that the vocal folds, unless there was a lesion, would look identical. So it's not the vocal fold that's different. It's obviously there's genetics involved. There's the length of the vocal cords. We haven't talked about pitch yet, but we will later as we go on. But the difference between you and me is the fact that your skull is different than mine. The length of your oral cavity, your tongue is different, your teeth are different, the hard palate is different. So the quality of your voice and the quality of my voice differs primarily not from the vocal folds and not from our air, but from the resonator. And the resonator is what changes the quality of our voice and the voices on the West Coast.
So they obviously have nicer resonators there.
Not necessarily.
Okay, so all you guys on the West Coast, sorry. Okay, well that's interesting. I mean, it's something I've always wondered about. What is it that makes our voices different? I tend to think, and I would think that it's probably most of it has to do with up here and how we use it.
Well, yes, our brains are probably similar, but if you really want to say how does one voice differ from another, a tenor has shorter vocal folds. A soprano has shorter vocal folds. A bass baritone has longer folds. A tenor has white cords. A baritone and a bass have more blood flow to their cords. So when you look at a singer with an endoscope or a laryngoscope, you will see that the texture is different. Obviously, the shorter the vocal fold and the tighter it is, the higher the pitch. So how does that happen? Well, there are muscles that actually are important in lengthening the vocal cord, just like you would lengthen and tighten an E string of a violin, and it would be higher. So if the vocal fold is stretched, you will get a higher pitch. Why? Because it's tighter.
Just like a violin string.
So it's not just the opening and closing of the vocal folds that's important to breathe and to phonate. It's also how tight we wind that vocal fold, and that's what gives us pitch.
Question, George?
There is a question in the chat room.
Okay. What's the question?
We got, and it just scrolled away.
A Mr. Richard Fainter of Fort Lee, New Jersey writes.
No. Anthony Geddick says, what could cause someone to have a persistent click in their speech?
I can take that one, Doctor. That'd be TMJ.
Is that right? My friend thinks it's in her mouth.
That's a bone. It's a bone click.
Not necessarily.
If it's a bone click, obviously every time you open your mouth, if you have a problem of the temporomandibular joint, that's a whole other area. But I don't know of people who have clicking in their voice unless they had a lesion on the surface. But I think TMD or temporomandibular disorder is a good answer.
John, good job.
Thank you. Or as my friends in Ethiopia say.
Okay.
No, those are Bushmen.
Oh.
Right.
All right.
We got more.
See here. There were some other questions in there, too.
Susan Bernard had a question.
I'm happy. Yeah.
Vocal warm-up, which sort of fits into there. Because as professionals, when I walk up here every morning after my morning coffee, I'm usually like, la, 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 la.
Really?
La. Oh, I'm a professional.
No kidding.
Yeah, so what is the best way to warm those complex vocal cords up?
Well, let's differentiate the speaker from the singer.
Okay.
Most professional singers on a day of a concert would never warm up for more than maybe 15 to 20 minutes before a concert. Mm-hmm. It would be like a marathon runner. Consider the professional voice user or the professional concert singer, opera singer, as a marathon runner. Now, would a marathon runner run 13 miles before his 26 miles? Of course not. So the concept that some singers have, which is wrong, is you don't warm up that much. You don't need to warm up that much. You have to do some warming up, but the professional singer might sing for an hour in the morning and then do nothing for the rest of the day, and then maybe 15 minutes, 10 minutes. For me, and I've sung opera, as you know, I rarely warmed up for more than 10 minutes because you don't need to, because you're going to use that voice for an hour or 2.5. And as I said, it's like the marathon runner. There's a vocalis muscle. That's the muscle that keeps on contracting and elongating. And the more you stress it, the more injured it could become. And that's why people develop voice misuse, voice abuse, which we'll get into later if you ask those questions.
Doctor,
which I suggest.
we did find Susan's question.
Yeah.
And her question was about throat clearing. Is if you some people clear their throats sort of persistently or habitually, harshly, is that damaging to the voice?
Absolutely yes. Clearing the throat is a manifestation of what we call voice abuse or voice misuse. And every time those vocal cords hit each other like this, can you see me?
Yep.
They will. Yep.
That's called a glottal fry. And every time, in other words, every time that you clear your throat, you are injuring the very surface of that vocal fold, which is critical for the quality of your sound. Now, one of the ways of stopping that, of voice clearing, is to be conscious of it. And if you have to do it, use the letter H. For example, instead of saying, and I'll give you an example, and it's a bad example of how you can abuse your voice, with the vowel G. If you said, go, that's you're hitting your vocal cord. But if you got that silent H and said, go, that's what voice teachers tell you. And I can't stress enough that if professional voice users get into trouble and their voices are altered and not as good as they would like them to be,
Go. I'm trying it right now.
Go. No. Okay. So what? Stop that. Now. This is the comedy now, right? I love it. I love it. The proper way to speak and talk is to have support. What does support mean? It means that you have to have a large, just like a singer says, oh. You have to take a breath. You have to have support. When people, and most good singers, it's a fact, do not speak well. Why? Because they don't support as they do when they're singing. So this is a little bit afar from the clearing of the voice, which can be a nervous habit. It could be allergy. It could be postnasal drainage. It could be coming from the sinuses.
Phlegm.
It could be coming. Well, phlegm is mucus, okay? Where does the nose produces a quart of mucus a day? Where does
I love mucus, any kind of mucus.
And it goes down the back of the throat. But most of the time we just swallow it. But if you have allergy, if you've got chronic sinusitis, you're going to have more mucus. It's going to go down into your throat. Incidentally, we talked about the true vocal folds. Above the true vocal fold is the false fold, or the false cord.
What is just faking it?
What is the function of that false cord, Dave?
What is the function of that false cord?
It secretes mucus. The true cord is lined with true skin. It's the only organ in the entire respiratory tract, except for the front of the nose, that has squamous epithelium, which is skin. And the false cords are respiratory mucosa with cells that secrete mucus and literally lubricate the vocal folds.
Wow.
Okay? That's the function of the false cords.
We never knew.
Well,
is it important to keep yourself to keep your vocal cords and your throat hydrated?
Excellent question, Dan.
Glad I thought of it.
Most professional singers drink a minimum of eight 8-ounce glasses a day. Now, there's an old adage which means P, pale, which means that most people who use their voice a lot, most professional singers, when they urinate, will have a very, very whitish appearance, clear, of course, not pussy, but white appearance to the urine, which is a pale color, which means they're well hydrated. So, Dan, your point is well taken, that a good singer, a good speaker, a good announcer will be well hydrated.
Now, if you happen to be in a men's room, don't be looking at the urinal next to you, because people frown on that. We'll take your word for that about the urine color of hydrated vocalists.
Just remember the two P's: P, pale.
I pee in a pail all the time.
Okay.
Well, you got to go to those baseball stadiums where they have the trough urinal.
Oh, please. Don't rip the scabs off of emotional wounds from Fenway Park.
Thank you very much.
Okay.
This is really fascinating, though.
No, it is. Thank you.
Let's talk a little bit about injuries, because, and we'll talk a little bit about getting a cold, because I remember a conversation you and I had on the radio, 25 years ago.
30 years ago.
Oh, crap. About what happens when you get a cold. But let's talk a little bit about some injuries that some people can get, because everybody's like, I'm here every day, I'm talking every day, all of our audience is talking every day, some of them good, some of them whatever. But if you use it too much, or if you use it incorrectly, what sort of injuries can people develop?
Well, you use the term injury. I don't know if that's the best term, but there are a number of problems that occur with misuse of the voice, overuse of the voice, and one of the common symptoms, Dan, is voice fatigue. So let's say you're a teacher. Let's say you're an attorney who's in court all day. God bless them. Okay. If you abuse your voice by overusing it, you'll have voice fatigue at the end of the day. So it's very common to drink water during the day. That will help to hydrate the lining of the vocal fold. But constant voice misuse and abuse, constant clearing of the throat, can lead to various, as you said, injuries. One of them is a vocal fold nodule. Right. Now, a nodule is simply a thickening of the squamous epithelium, the lining of the true cord. You can develop hemorrhage into the vocal fold, which is a very serious problem for a professional singer. And absolute voice rest would then be necessary for 3 to 5 days, and hopefully it would clear. Most professional singers, most professional speakers have a laryngologist. And I just want to say
that's what Adele went through recently, right?
It's very important that you have an ear, nose, and throat doctor who really knows about the voice, because there may be guys who are otologists who just do ear surgery, guys who just do nose, sinus surgery. You have to get a person who understands the professional voice. And I can't emphasize that enough. So you can develop a nodule, hemorrhage, a polyp, which is a thick, fleshy thing, which very often requires surgery. And for the professional singer and the professional voice user, the one thing you want to avoid is surgery. Because if you have surgery, you're going to develop scar tissue. And it doesn't matter who operates on you. Once you develop scar tissue, your voice will never be the same.
Julie Andrews. Julie Andrews.
Good example. She had surgery, and I think she lost her voice completely. But all I'm saying to you is that sometimes surgery is necessary, and in the hands of an excellent surgeon, it may turn out okay. But in general, for the average laryngologist, once you start to pull on that vocal cord and cut it, it's gonna heal. Now, one thing I didn't mention is that the vocalis muscle obviously is the muscle that allows us to differ in pitch. The tighter it gets, the higher the voice. But there's a mucous membrane that rolls over. Now, that mucous membrane, that rolling action, is the vibratory quality that allows us to change from a low tone to a high tone, okay? And if you get surgery, there will be scar tissue between the cover and the muscle and will prevent that rolling action. And once you prevent the rolling action on one chord, you make it asymmetry. The vocal fold on the left may differ from the right in terms of its frequency of vibration, and you've got a problem.
What about teas, sprays, pomades, greasy kid stuff, whatever they are trying to sell out there that's going to make your soothe and smooth the voice? We've got throat coat tea,
Entertainer's Secret,
Entertainer's Secret,
Well,
Singer's Friend,
alcohol.
Okay.
Alcohol.
I'll ask you folks a question.
Yes.
Okay. When you drink something, where does it go?
In
your stomach.
In your stomach.
Well, before it goes to the stomach,
Mouth.
what's the tube just behind the vocal cord?
The esophagus.
The esophagus. All right, so when you drink hot tea or cold water, it's going down your esophagus into your stomach. It has no effect on the larynx whatsoever, except to say that mentally, when you drink something cold, it feels pretty good.
Yeah.
But it doesn't have any effect on the true vocal fold because the true vocal fold is anterior in front of the esophagus.
Right.
So the only thing that it might lubricate or make feel good is the back part of the larynx. Now, that's a very important thing. There are two cartilages back there.
Mm-hmm.
They're called the arytenoid, A-R-Y-T-N-O-I-D. The vocal fold is attached to the arytenoid, and when the muscle pulls the vocal cord apart, the arytenoid is the cartilage that comes back in adduction, adduction, and the muscles that pull it out are called AB abduction.
Yeah.
So it is true that when you drink, it is possible the arytenoid mucosa could be soothed, but the actual true vocal folds are not involved in drinking anything.
Could you, Doctor, could you kind of work up some little snappy musical number to explain all of this? Like, the arytenoid's connected to the vocal fold's connected to the esophagus. You know, make something up like that, because for us it might be easier to digest. There is going to be a quiz. People wanted to know about this.
I know. I don't need to sing it, okay?
All right. Well, you were doing
as much
good
as
earlier.
we want him to. But.
No.
We like the singing otolaryngologist.
Hold on. What did I say before were the three important things about voice production? Number one, the actuator. What's the actuator?
Brain.
The lungs.
No. But the brain actuates the lungs.
Yes, the brain comes first, but in terms of the air that comes from the lungs, you can't make a sound without the lungs, okay? Then the vibrator. The vibrator is the larynx, which changes pitch. And then the resonator. The resonator gives quality to the sound. Okay, so just think about this. The actuator is connected to the vibrator is connected to the resonator, and all of these are activated by the brain going through the vagus nerve to the various muscles of the larynx, which change pitch. And actually, the resonator is the tongue, the teeth, the lips, the hard palate. Let me give you an example by singing something, okay?
Yay!
All right. Please. If I were singing like Frank Sinatra, I might sound something like this. It's very clear, our love is here to stay. Not very good, but basically he sang primarily with his vocal cords. But an opera singer would sing something like this. It's very clear, our love is here to stay. What was the difference? It was how I projected the sound toward my hard palate. And that was the only difference.
Not
same
for
words,
a
same
year,
melody,
forever and
saying,
a day.
I said, okay? So that's the difference. And that's the difference between a great singer and a mediocre singer. All the pop singers out there, probably in my day, were guys like Vic Damone, Eddie Fisher, Jerry Vale. Vic Damone, for me, was almost
Sid Vicious.
close to a classical singer. even though Frank was outstanding, I mean, he was one of the greatest vocalists of his day, and he could sing high and he could sing low, but he still was a crooner. An opera singer has to go through the orchestra.
Without a microphone. Those people became singers in microphone times. He's got no headphones on. We could talk about him.
That resonator that allows that sound to pierce through the orchestra. That's why, you know, a very good singer, a very good concert singer with an orchestra doesn't need a microphone. Okay? Wow.
And of course, all these guys like Sinatra and Mel Torme, they had a Vagus nerve.
Well, Mel Torme was the Velvet Fog, but I have to tell you this about Mel Torme. He was one of the greatest musicians I've ever heard. Even though he sang falsetto. He sang falsetto. You know, he said, you know,
put his headphones on his head.
No, what is falsetto? Falsetto is where the vocal folds. He's telling me to put my earphones on.
Yeah, because John's making fun of you now.
Falsetto is where the vocal folds don't completely come together, and there's more air escape. Now, can you sing on a closed glottis when the vocal folds are completely closed, like when you strain, when you're having a bowel movement, or if you're pushing something? What's the answer to that?
No.
Sometimes when I'm having a bowel movement, I sound like Barry White.
Right. So the production of sound for you as speakers and singers is air must go past that glottis. It's like thinking about bending down in the grass and blowing the blades of the grass. They're going to move up and down. That chopping moving up and down is what produces the sound. You have to have movement of air through the glottis in order to have a sound. And that's how we speak.
I have a question, a serious question. Serious question. There's people listening that do radio imaging. I have stations that want to have that ballsy sound, so it's like
Rock 107, the only station that really rocks.
But I do that stuff in the morning, at like 4 in the morning. I have like a cup of coffee, and I get up there and I go,
the only station that really rocks.
Now, late in the day, it's not the same.
Right.
John, let me tell you that if you do that enough, you will ruin your voice because you're abusing it. That's not how people speak. I mean, yes, you can lower the pitch of your voice.
We keep telling producers this all the time. But
that's what Zurich does, too.
The point is that listen to all of the newscasters on NBC, CBS. They don't have these fantastically dark, rich voices. They've got good voices, and they'll last for a long time.
But they're not voice artists. That's not what they do. They're just readers.
Well, what I'm saying to you is what that quality of sound that you just made there is an abnormal sound, and you know it's abnormal because you wouldn't do it all day because by the end of the day you wouldn't be able to talk.
I don't do it past 5:30 a.m.
I would think that would be a manifestation of voice abuse or voice misuse.
But it pays the bills, baby.
People. Well, but how long do you do it a day?
It's only 30 years so far.
No.
You'll only do like 3. I don't do it all day. There's I might do it twice. I might do 2 or 3 lines twice a week. In that kind of.
All right, but that's fine.
Yeah, not every day.
For 3 hours, it might alter the tissue in your vocal folds.
Gotcha.
Okay.
All right.
Just like Mom and Dad, if you keep doing it, it's going to stay that way.
Exactly.
Stop crossing your eyes.
That's right.
Diane Merritt's voice is lower in the morning, she says.
We've got a ton of questions. An absolute ton. I mean, we could
we've gone back to weekend at your service here, Dr. Bernstein. You would be amazed at the questions we got when
there's
the radio.
May I just make one more comment before I take the questions?
Sure.
We didn't get into inflammatory diseases, Dan, and I think
we were getting there. It was next on the list.
I just want to say one thing for all you people who are listening. It is very important that you understand that upper respiratory tract infections, colds, rhinosinusitis, sore throats, about 98%, and it's not a guess, it's a fact, are viral. Don't ask for antibiotics. Right. You're making a big mistake, because if you're not better in 5 days, if you're getting worse in 5 days or not better in 10 days, empirically, I would put the patient on an antibiotic. But when I hear of general physicians treating patients over the phone for a 2-day history of a runny nose, that's not acceptable medicine. Okay?
Well, glad to hear that.
Yeah.
All right, what were some of the questions we had there, George?
Well, we had Pat's voice saying, aside from resting one's voice, are there remedies that can be recommended for voice actors?
Sounds from what we learned about the whole big picture of this thing, no. You should stay hydrated and rested. Don't abuse it.
Yeah, it's like people that want to get sober faster.
You've answered the question, but I will tell you this. When I had the opportunity to sing with the New York City Opera about 30 years ago, you would be surprised that most professional singers walk around with boxes full of pills. Yeah. Those pills consist of, number 1, antibiotics, number 2, painkillers, and number 3, steroids.
Yikes.
Okay? But I want to tell you that in the case of a person who is a professional singer who needs to sing in 48 hours, I would not hesitate to put that patient on a high dose of steroids for 2 to 3 days.
Prednisone?
Because an inflammatory... Yes, or methylprednisolone, dexamethasone, they're all steroids. But the steroid is an anti-inflammatory drug, and it can work like magic within 2 or 3 days. Okay?
Is zinc of any help at all? That came up too.
On your nose.
There's no evidence that zinc helps colds. I know that it's out on the market.
Yeah.
Perhaps over the counter. I think that has been squashed pretty well by the medical profession. I don't think there's any evidence. You got to remember that a viral infection gets better spontaneously in 7 to 10 days.
Right.
So if you took zinc on the 5th day and got better in the 7th day, and you have no controls, you don't know whether the zinc did it or you got better on your own.
Right.
Good point.
How about GERD or GERD? Someone mentioned
that. What a great question. Do you know that gastroesophageal reflux disease, which you called GERD, is an exceedingly common problem and is one of the most common causes of voice disorders? And it may be that it represents over 50% of voice disorders in people over the age of 40.
Yeah.
Great question. And the answer, the great answer to it is that this is truly a treatable problem. Number 1, there are drugs on them that you can take, which are prescription drugs, but now over the counter, like Prilosec, the pink pill.
Yeah.
You take that. Usually, otolaryngologists who are involved in voice, who have, and when you look, incidentally, when you look at the larynx with your endoscope, we don't use mirrors anymore. We all use endoscopes because we can see the whole vocal fold from anterior to posterior. You will see swelling of the back part of the larynx. Why? Because the esophagus is there, and as the acid from the stomach comes up and literally chemically burns the arytenoid mucosa, you can see redness and swelling. Very rarely, occasionally, there's actually granuloma, proud flesh formation there.
Oh, and no.
And the use of Prilosec twice a day, 20 minutes before breakfast, 20 minutes before dinner, and Zantac, which is also over the counter, Zantac, 150 milligrams QHS at time of sleep. Do that for a month, and in most cases, the GERD will become controlled. Now, the major problem of GERD, however, is that if you have it long enough, you can develop significant alterations of the lower third of the esophagus. And
what does it say?
That means that you should see, if you do have GERD, ultimately you need to be seen by a gastroenterologist so that they can look down there and make sure you don't have what is called Barrett's esophagus. 10% of Barrett's can develop cancer of the lower third of the esophagus.
That sucks.
Just from acid, going up. And when we get older, that sphincter between the esophagus and the stomach, logically called the gastroesophageal sphincter, gets loose as we get older. So when we lie down at night, if we eat big meals at night,
your gastroesophageal sphincter is loose as you're older?
It's as we get older, the sphincter is not as tight, and therefore, you know, when you go to sleep, you're paralyzed, right?
We are such children. I apologize.
We are.
You're paralyzed. So that means that the sphincter's not even functioning. And let's say you went out on the town.
Speak for your own sphincter.
A big meal, just 3, greasy meal.
Right.
You go to bed at night, that stuff's going to come right up your esophagus, and in the morning, you're going to have acid reflux.
Big time.
That would explain a lot.
There's
Okay,
one last.
they would.
Should we do one last question from the chat
One
room?
question, and then I've got another question.
Got Verana said, "I would like to hear more about reducing mucus because that's a big problem with mouth clicking and all that stuff."
Well, first of all, she needs to know that the nasal lining produces a quart of mucus a day. So you can't reduce that. That's the normal physiological phenomenon. Why? Because the nose has to humidify the air coming in, and the blood vessels in the nose have to warm it, so that by the time you go out in freezing weather, you breathe in. By the time that air, those air molecules hit the nasopharynx, they're they're a body temperature. Why? Because of the function of the nasal mucosa. So you have to have mucus. Now, where do you have excessive mucus? That's when you have inflammatory disease of the nose, sinuses, back of the throat. And then the answer to her question is there are mucolytic agents. Mucinex would be one, Robitussin would be another. They're over the counter. And they can definitely liquefy the mucus and make it easier to handle. Okay?
Question, at what point does mucus become boogers?
When it dries up.
Danny Leonard could be a doctor. That's exactly correct.
My mother would have been so proud.
When the your Jewish mother. Okay. What Dan just said is essentially correct. Buggers or hard mucus just means dehydrated mucus. It just means that.
Don't touch me.
If the
roll it
mucus
and flick it. Roll it and flick it.
If the mucus stays there long enough, it does lose water and it becomes harder.
Right.
That's why you roll it before you flick it.
Okay.
All right. All right. Okay. All right. One last question now.
Yes, sir.
Yay!
Now, a real controversial voiceover question, because I mean, aside from PC and Mac, which we all argue about, and sometimes in some of the forums it gets pretty nasty. Another one is the use of headphones, which we're both wearing right now. Of course, I'm wearing the earbuds, and you've got the the big ones on there. But a lot of voice actors will wear headphones, and some will not. And I've always said that if you're wearing headphones, you're not hearing yourself as others hear you. So I got a $50 bet rolling on this one. So what's the reality of that? Should people be wearing headphones when they're talking? Will it affect their voice at all, or how they hear themselves?
I think that it will not affect you in any way. I'm going to do this. I'm going to count to 5 with the earphones on, and then I'm going to take the earphones off and count to 5, and you tell me if there's any difference. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now, the guys on the West Coast, was there any significant difference?
You talking to us?
Are you there?
No, they're there. Yeah, we're talking.
Wait.
No, there wasn't any difference.
Any significant difference?
No.
Okay, now the only thing I can tell you about wearing phones is that you're probably hearing more by bone conduction,
right?
Because the sound coming in through the air has been modified or blocked, but the quality of the voice and the frequency of vibration doesn't change. So I don't think that there's any objective evidence that wearing earphones would do anything bad or change the quality, frequency, amplitude. You can talk soft, you can talk loud. The fact is, right now I'm hearing my voice through the bone because the environmental sound has been dampened by the headphones, and that's the only difference. That's the best answer I can give.
It also ruins my spiky dew.
That's right.
that will definitely.
It can also ruin your hearing. I have clients who have been wearing one headphone, a cup on one ear, for many years because they want to hear themselves in the room more naturally, and they have now lost the hearing significantly in that one ear. Scott Rummel would be a good one.
George,
yeah.
Can I address that question? Because I'm also an otologist, and actually that is my area of specific specialty. Now, the answer to your question would only occur if that person was exposed to 85 decibels. You use the word decibel, and I tried to think. A decibel is used because the bell, which was created by Alexander Graham Bell, is such a large quantity of sound pressure. We measure sound pressure in dynes per centimeter square. But that would be like almost 1 million changes in the velocity of air molecules.
Yes, it's a logarithmic scale.
All right, you guys, my head's going to explode.
So what I'm saying is, as long as you're exposed to less than 85 decibels for 8 hours, George, it's very unlikely that you would develop any hearing loss. So, on the other hand, these kids now with iPods. Is that a signal?
No, he's saying
a dB is 1/10 of a bell.
A dB is 1/10 of a bell.
Right.
Thank you, Nerdly Nerdlestein.
And would be and one decibel would be about 0.002 dynes per centimeter square, approximately. Now.
Thank you, Dr. Honeydew.
Okay. You can call me Joel. Now. Seriously, this is a fun show. I hope I'm not being sort of ridiculous.
No, you're being totally serious, but
we're being ridiculous.
We're being ridiculous, but a lot of these announcers started off on the radio, and they had their.
Let me tell you something though that's very important for you to know. We're seeing younger and younger people developing permanent high-frequency hearing losses.
Yeah.
What? Why is that? What?
Because they have their headphones on and they're louder, and they go to the and the DJs have it up turned up real loud as they're doing
concert volumes. Everything is louder. Everything is louder now.
And remember,
movies.
We've got OSHA has given us rules. If you're not exposed to more than 85 decibels for 8 hours, you're okay. But we have to teach kids to quote turn it to the left. And that doesn't mean being a liberal. It means turning the volume down.
Turn it up to 11.
Yeah.
Right.
I mean, we are seeing college kids. You know, there was a study recently done of occupational hearing loss, and they used college students as a control. They couldn't use them. They all had high-frequency hearing losses at age 21 and 22.
Hey, I got to go pee something clear. And white.
You got to drink 8 ounces of water, though. George.
Oh, okay. In my East-West Audio Body Shop's coffee mug, this is the travel version, which you can find at the store. And how do you get to that?
Shop.ewabs.com.
Shop.ewabs.com. Also, the Harlan Hogan Porta Booth is one of the sponsors of East-West Audio Body Shop.
We're gonna talk about that in a minute. I promise.
Just thought I'd throw a little commerce in there, Doctor.
Harlan.
We got to pay our doctor bill somehow. You people have big co-pays.
That's right.
Yeah, you Massachusetts guys. All right.
Thank you, Doctor. Thank you very much.
It's amazing.
A pleasure to have you on our show tonight.
Well, I hope I answered some questions, and thank you for having me.
No, you did. People are saying, like, where else are you going to hear this stuff? Which is absolutely true.
Medical school.
Yeah, I mean, you'd have
to pay for it.
Exactly.
He's still paying the loans off.
No doubt. Thank you again.
Thanks, Doctor.
All right. Well, we'll be back in just a minute. Thanks again, Dr. Bernstein. Stay tuned. We'll be right back here at East-West Audio Body Shop.
Well done.
Hey, my name is Bob Ball. I'm a voice actor and host of Pop Quizzical. Sure. I hear you thinking, Bob, what is this Pop Quizzical you speak of? Well, I'll tell you. It's a fun and funny, single-themed 10 to 15-minute audio quiz. It comes out every other week right here on the internets. You know, that thing that just about everything cool flows from. You know, pictures of cats, videos of dogs, and yes, Pop Quizzical. It's available on iTunes and wherever fine podcasts are sold. And it's easily found, too. Go to bit.ly/popquizzical. There's also a companion website at popquizzical.com with daily quiz questions, and every Friday over on the Pop Quizzical Facebook page, it's a freebie Friday. Free stuff throughout the day. From The Muppet Show to James Bond to St. Patrick's Day, the Pop Quizzical podcast has a little bit of everything for you. Challenge your mind and your funny bone with Pop Quizzical.
Class dismissed.
This is East West Audio Body Shop with Dan Leonard in the East and George Whittam in the West. Now back to two characters that didn't have anything else better to do. Dan and George.
Your sweater's right there.
I thought it would be fun to show Dan repositioning Frank and Mike.
Well then.
Frank and Mike.
I am repositioning Frank and Mike. Haven't you seen Frank and Mike before?
It is the most beautiful microphone I've ever seen.
It is.
Doctor, mad scientist. Oh, and I love the way you put up your reflex.
Yeah.
By using gravity and friction and static electricity to hold up your acoustical panels, you are an evil genius.
Anybody know what Furalex is?
And actually, his wig fell off. What?
Anybody? Furalex. I've seen that.
Is that a new kind of acoustical treatment?
Not that I'm aware of. I've just seen it come up. Have you heard of that?
Furalex?
Furalex? No, it's just hair.
Furalex. Furalex, as in Oralex with a FU.
It sounds like, well, FU too, buddy.
Right.
All right. Okay.
He's a trooper. The doctor's a trooper.
I told you. What did I tell you guys? I said Dr. Bernstein would be great.
No one would ever get that much time with a doctor the way things work in doctor's offices now. You couldn't ask those questions on an appointment.
No, you'd have to come back every month for a year.
For a year. Yeah. Seriously, you can't can't ask a question. They're like, come on, we got open up.
I get it.
You're done.
And he's very quick in his office too. So.
Yeah,
but very personable. Great guy. Great guy. Anyway, also a great guy is Harlan Hogan.
Indeed.
Hogan.
Because he's got voiceoveressentials.com, which if you're getting voiceover stuff, that's the place to go because prices are good, easy to order there, and he's made the selections of good stuff for you already. So you don't have to ask, well, you can call me and ask me. You can call George and ask George, what's the best microphone to have? You know how many times we get that in a day?
What's the best microphone to have?
Exactly.
See, that's 8 today. You just had I already had 7. The best place to go is to voiceoveressentials.com because he's got all the stuff you need. Aside from the VO1A, he's got some other stuff in there, but he's also got
Here's the new ABS adjustable boom stop.
I love an ABS adjustable boom stop. There's so many times when my boom just won't stop.
I'm using mine right now.
What the heck
It's holding Frank and Mike up.
What is that?
Well, most of us have cheesy mic stands with a limpy or not very strong
I know.
Pivot lock.
It's called pivot lock dysfunction.
That's right. And this supports your loose pivot.
Yeah, it's caused by BPH, enlarged prostate. But Harlan Hogan has the solution.
Yes, he does.
And he's ABS adjustable boom stop.
That's right. For 1995, he will personally come over and support
your boom.
Right. Actually, this is the closest you're going to get to Harlan coming over and supporting your boom personally. This sucker just keeps the boom from sagging because these cheap boom stands don't have counterweights anymore.
Right.
They just have a plastic piece on the end.
Yeah, those big studio. Jim Tasker was telling me that he did all of these NFL promos and stuff. They're all done with the porta booth.
Yeah, well, he was in Vegas, I think, at the moment.
Yeah,
and he had to bring his porta booth with him. So.
From Harlan Hogan.
There you go.
Laboratories and Enterprises.
Outstanding.
Thank you, Harlan.
Thanks, Harlan.
Thank you. Thanks, Harlan. Alrighty. Well, we've run a lot later than we usually do. Should we just keep going here with our pick and clip of the week?
Yeah, why not?
All right.
All right. Well, I got
to dry out some mucus.
Yeah.
We got to work on that. I do have. Okay, so the pick of the week, since we haven't really gotten a lot from the viewers. Hey, you guys, we go. We've got some pictures and.
We keep asking, yeah.
I know. I've got some shots of the mics we had set up at the Don LaFontaine voiceover lab.
Nice.
The other night on Wednesday night, we had our guest from last week, Michael Deming, in at the lab to test out these mics. So I rigged them up and put them in the lab, and we ran them all at the same time so voice actors could come in and hear all 4 of these at the same time. We've got, in no particular order, a Charter Oak E700. That's that big whamma jamma there.
Oh, that's the big whamma jamma.
That's the big whamma jamma.
Studies have shown that silver and chrome-colored microphones are about the best there is.
And then there's the new Charter Oak S700. That's the one that's pointed straight out. That's the end address mic. Then there's a 416 in the middle, which is a nice control mic because it's one that's heard very often.
Nice.
And then hidden around the other side is a Audio-Technica. That's the AT2020. That's your bargain bin voiceover mic that a lot of people throw in their bags for travel. Or
how much does that go for?
It's under $100.
Under $100.
That's the studio one. They have a USB one too. That's just over $100 or so. So anyway, we ran them all together,
and
we came out with a big, ginormous mess. No, here's a couple of samples.
Whose voice will it be?
Well, let's make sure I got my audio patched correctly. Yes, it did. I don't know whose voice you're going to hear because I didn't do enough show prep to actually figure out who it is you're going to hear when I click this play button. But if all goes well, you'll actually hear something, and we'll be able to make some determination of what we got here. So
click.
Wish me luck. Here's the first microphone sample.
Here we go.
Every day, the world gets more complex, and this is what inspires us to create new technology. Technology that connects us to everything the world has to offer, and vice versa.
Okay, that was the first one. Then we'll play. We'll play the second one. I'll see if I can get a little higher output here for you guys. Sorry about that.
Every day, the world gets more complex, and this is what inspires us to create new technology. Technology that connects us to everything the world has to offer, and vice versa. Technology that makes lightweight, stronger, safer, and faster than ever before.
These mics suck, George.
Here's the next one.
That was the 416.
This is the next one.
Every day, the world gets more complex, and this is what inspires us to create new technology. Technology that connects us to everything the world has to offer, and vice versa. Technology that makes lightweight, stronger, safer, and faster than ever before.
Nerve damage
And the
from
last one.
hip-hop shows. I don't know.
Oh yeah, tell me about it. Let's see if I can get the last one.
Oh yeah, tell me about it.
Every day the world gets
Every day, the world gets more complex, and this is what inspires us to create new technology. Technology that connects us to everything the world has to offer, and vice versa.
All right.
What was that?
That was all 4 mics. The last one was the S700.
How much does that cost?
$699.
All right. Sounds okay.
Sounds okay. That's the new one that he came out with. That's their broadcast mic. The E700 was the very first microphone, and the 416 was the second, and the 2020 was the third. And just to show you a little bit more of the setup, here's the
array.
Here's the point of view of the voice actor, and here is the room in which we were doing it. That's Michael sitting there.
Yep.
And Eric, who's the lab administrator. And we have the preamp that he brought in for us, which actually now lives at the lab. It's been donated. With the lid off. That was my idea, because I wanted to show what the inside of a really made piece of gear looks like. So that's with the lid off. So
yeah,
anyhow,
that looks great until you spill a coffee in it.
Yeah,
really.
So I recommend not having a coffee over top of it at all times.
Question.
Yeah.
A Mr. Richard Fainer of Fort Lee, New Jersey writes in and says, John, can you ask the guys if they could tell me for $500 or less what's the best mic all around?
You got it. You got it.
We get that one every day.
$500 was the cutoff, though.
The best mic for under $500?
Yeah.
There's been a lot of these things going around the web. Yeah, go ahead, Dan.
Well, the question is the best mic for who?
All around.
There's no such thing as a best mic.
I know.
You know, there's going to be a mic that's going to sound fairly
Thanks
good
for
somebody
answering your
else.
question with a question, but I just need to get an
Jewish,
answer to
what can I
Mr.
tell
Richard Fainer of Fort Lee, New Jersey. It's actually one of my former bosses. Asked this question in an email last week.
So this discussion comes up all the bleeding time.
And
on
it's
the
a guy
forums.
with nice, big, rich pipes.
Okay. You know what's funny? People think that to capture a mic, a voice well, you have. Let's say if a mic, let's say if the voice has a lot of bottom end.
Yes.
The first thing you think is, I need a mic that exaggerates the bottom end. That is a boomy, bassy mic.
Right.
And likewise, the other way around. When somebody has a squeaky high voice or a very treble voice, you want a mic that's very sensitive to the treble stuff.
Right.
And it's exactly the opposite.
Right.
You want exactly the opposite. So women do much better on mics that accentuate the lower end and maybe are a little smoother, or even, should I use the word, warmer, less bright on the top end. And so ribbon mics have been used for recording female vocalists over the years. I used to put one up in front of a vocalist friend of mine who was a theatrical singer. What's that called? Music theater singer. She could really...
They call that Eliza.
Yeah, she could really belt. There's a lot of mid-range in her voice, right?
Yeah.
So the ribbon mic would tone that down. So...
Could you demonstrate that one more time?
Yeah. Everything's coming of roses. Like
That'll be on the Christmas party reel.
So you want a mic that contours and basically acts like EQ or tone control to remove whatever it is that's offended.
If you had a guy who had a nice, naturally rich, bassy voice,
yeah,
$500, what would you buy?
Well, I think Paul mentioned the CAD E100S, which is probably one of the best mics you've never heard of. They're made in the U.S., and they are definitely under 500. I think they might be in the 400 ballpark.
Okay. CAD?
The CAD E100S is a really nice one. Sennheiser came out with the MK4, which is a $300 large diaphragm condenser mic. A $300 German-made mic, and it's quite nice.
Really?
Very, very nice.
All right, I'm a fan of Sennheiser stuff.
If you like Sennheiser, you know, you like German.
Yeah, das ist ausgezeichnet.
That's hard to touch.
Make you sound excellent.
Yes,
I'm going to hold my
touch.
cigarette like I'm from Germany.
Yeah, jawohl. Of course, there's a lot of good mics you can buy used that will fall into the $500 range. When it comes to buying used mics, you really got to be careful.
I'm hinky about it.
You got to make sure you get a good return policy on that thing and try it out as soon as you open it from the box. They can get damaged so easily, and you never know what the heck that thing.
All right,
went
Mr.
through.
Richard Fainer of Fort Lee, New Jersey. There's the answer to your question.
Does that answer your question?
I think it does very thoroughly.
He's from Jersey. All righty. Well, John, thanks for being with us tonight.
Oh, thanks for having me. It was really enlightening.
It was.
It was.
I told everybody Joel was going to be very enlightening. And you've been more than enlightening, and
it's
more like
the GERD.
It is. It was great to have you here. I'm glad you were out that way, and you could drop by George's place.
Me too.
And
And
if we ever run out of fuel on my plane going over Buffalo, I'll come by your place.
Please do.
Buffalo, one of those flyover cities.
Well, if I had a reason, and you're a good reason. But I would stop. I'd love to see Dan's place.
Me too.
The new setup in the studio.
It's long overdue that I make a visit.
It looks fantastic.
Yes, indeed.
Yeah, You've got Pennsylvania peeps. You should be up there.
Yeah.
Well,
and it's 105 degrees here today. So.
Oh cripes! It was 105 in Dallas too.
No, it wasn't 105. It was 105 in where you were.
Yeah.
In Hollywood.
Yeah.
Out here it was probably about 90.
Yeah, but that's really hot for Santa Monica.
Oh heck yeah.
Yeah.
Oh yeah.
But we're
that's
not
why you have
dripping
the
sweat
ocean
right now.
No, we're not dripping sweat.
No, we're not. All right, everybody, let's get that blazes out of here and go get some dinner.
I think, but still, you guys are still watching this show. What is it? We can go on for hours.
Anyways,
Marcy's like, no, is you still doing this show? What is going on
we're
in there?
still talking. It's a new record, by the way. 1 hour and 35 minutes by the time we sign off.
Let's see if we got a tote board. Timpani! It's turning into a Labor Day telethon.
Oh, okay. Anyway, thanks everybody.
All right. Thanks for joining us tonight. I'm Dan Leonard. Oh, by the way, we've got to talk about who's coming on next week.
Ellie Ray Hennessy from Toronto.
Yes, Ellie Mae Clampett.
This woman is a loose cannon.
Oh man, I want to see that.
Don't miss it.
I love a loose
cannon.
Can
you imagine the two of them in the same room?
Oh my God, it would be Loose Cannon, a Quinn Martin production.
That's actually a good name for a production company. Loose Cannon Productions.
Yeah.
I remember.
Live Wire, Loose Cannon.
We're Cups and Strings Productions.
I'm your one-stop shop for unpredictable behavior.
And so we've got Dave Fennoy coming up.
Yep.
Love
Catherine,
Dave.
Catherine, you're supposed to fill me in. Who else we got coming up? We got Dave Fennoy. We got Ellie Ray Hennessy. I think we've got October 9th. He'll be on. And then we've got... Simon Vance is coming on.
Oh yeah, Simon Vance of book narrator,
right? And of course, John Taylor, America's Way to Silver Sweetheart, will be with us probably a million more times.
I got on a plane to come out to L.A.
Yeah.
I have an audio book that just came out that I narrated.
Yeah.
It came out like a month ago.
Yeah.
The author of the book sat in the row in front of me.
How the heck did you know that?
The dust jacket picture.
Oh, okay.
It was the weirdest thing, and he introduced his wife. I said, I know all about her, chapter 8. Isn't that the small world?
That's unbelievable.
I kicked the back of his seat the whole way.
That's unbelievable.
Accidentally. Not a lot of leg room.
I'll have a little story about the process of replacing my computer case, the case to my PC.
Wow.
I've got a new silent case that's lined with acoustical absorption and all this stuff. So I'm going to have a better microphone, rumor has it, soon, and I need the room to be quieter. So that's I'll document that because it's a lot of work.
You got to poison that chihuahua out back, too.
That too, yeah.
And our buddy Harlan Hogan will actually be on September 9th. He's got a big announcement again. God, the guy's always announcing something.
Harlan's a mover and a shaker.
He is.
He is definitely the man in our business. Yeah. Anyway, thanks again, John.
Thanks for having me.
And our thanks again to Dr. Joel Bernstein, who will be back sometime. And he's probably, I told him we have to do a Gilbert and Sullivan piece next time. He does Gilbert and Sullivan. He's amazing.
No doubt.
Anyway, I'm Dan Leonard in the East.
I'm George Whittam in the West. And this
and together we are
America's voiceover sweetheart.
And together we are
East West Audio Body Shop.
Bop, bop,
bop, bop, bop. Batting seven.
Thank you.
Have a great week, everybody. We'll see you next Sunday night.